My name is Ebony Schutz, and I'll be doing the Indwelling Catheter Checkoff. So first, you always want to verify procedure and hospital policies. I'm then going to wash my hands. Identify the patient using two identifiers: Jaguar Jones. Date of birth 8/25/1963. Date of birth 8/25/1963. And explain the procedure. So today, Ms. Jaguar Jones, we will be inserting an indwelling catheter inside you, if that's okay with you. And then I'm going to assess for allergies. So allergies, penicillin. Three indications for an indwelling catheter are required immobilization for surgery, trauma, or other therapies, strict urinary output monitoring as indicated by plan care of, to assist in healing of open sacral or perineal wounds in incontinent patients. So I'm going to go ahead and gather my equipment. I'm going to don my goggles. I'm going to position the trash can near, and I'm going to go ahead and wash my hands again. Now I'm going to go ahead and raise the ventral working level, lower the side rails, and I position my patient in dorsal recumbent with her knees slightly bent. So now's the time where I would first provide perineal care. So I would don my clean gloves. And for females, you want to clean cleanest to dirtiest. So the labia far out, labia near, straight down the middle with warm soap and water. For males, you want to also use warm soap and water, starting at the glands of the penis in a circular motion, moving back, you clean. So I would provide perineal care. Now I'm going to go ahead and open my kit. I'm going to use the bag as a trash can. And I'm going to don my sterile gloves. Usually you would don sterile gloves on a table that's at least waist height, but this table is lower than waist, but this is all that I got, so. Make sure there's no gaps. I'm gonna take out my tray. Bring this towards. I'm gonna open my Q-tips and place some lube. I'm going to connect my syringe to my catheter. And I remove this plastic. I'm going to lubricate the catheter 1 to 2 inches for females, 5 to 7 for men. I'm going to spread the labia. Now I'm going to provide perineal care. 2, 3. I'm keeping my hand on my patient. I'm going to start inserting my catheter. So once I receive urine return, I'm going to insert 1 to 2 more inches for females, all the way to the bifurcation for males. I'm going to blow up the balloon. Making sure I remain pressure on it so that the catheter doesn't dislodge. I'm going to remove the syringe. I'm going to pull some of the catheter out. Once I feel it tug, I'm going to advance it 1 to 2 inches. Next, I'm going to stat lock the catheter to my patient's thigh so that the catheter doesn't dislodge by itself. So I'm using an alcohol pad. I clean the thigh area. I'm going to lock this in. So make sure that the airflow is bleeding towards her vagina. I'm going to put the catheter in and lock it. Just like that. And then to unclip it, you just press this button, unclip it. So I would place this on my patient's thigh. And then hang the bag below bladder level and onto the bed frame and not the bed rails. Okay, now I'm going to go ahead and demonstrate how to collect urine from the bag and then urine from the port. So first I'll show from the port. So using a syringe to collect the urine, I want to go ahead and clamp the tubing. I'd open my specimen container, connect the syringe to the port, and I'd withdraw the amount of urine that I needed. I unclamp. And then I would pour the urine into there. Close it up. And then using these, you put name, date, time, room number, doctor instructions. So that's from the port. From the bag, I'm gonna move it down. So I would place a towel down here while I was down here on the ground. Put my graduated cylinder down here as well. So using the bag, they have this port down here at the bottom. And so this valve can switch on and off. It's off right now. So I would catch the urine like this. I close this, close the valve. Then I close this and send this off to the lab. So next I want to go ahead and discard of my equipment. I would discard of my equipment. Remove my gloves. I go ahead and position my patient back comfortably. I'd raise the side rails. I would lower the bed to a working level and then make sure I place the call light near. I'm gonna go ahead and wash my hands, and then I document catheter size, the type of catheter, my patient response, urine return, the color, things like that. So with the patient having an indwelling catheter in, we want to make sure that we provide peritoneal care daily after incontinence of stool so that it prevents any pressure wounds and skin breakdown. So now with discontinuing a catheter, I put on my goggles and I'm going to don clean gloves. And then I go ahead and position my patient, lower the bed, lower the side, raise the bed to working level, lower the side rails, position my patient. So when collecting urine out the bag and measuring it, you want to get down on the ground again. Put your towel down here. Your graduated cylinder is going to catch the urine. So I would just catch the urine like this and empty it. This is how we were able to measure. So I wouldn't, in real life, I wouldn't be touching the camera like this. So this stat lock would be on my patients. You're able to remove this stat lock with alcohol. So you just use alcohol there. But you can unclamp this stat lock. So I want to loosen up my syringe so I can withdraw the bubble. Connect it, and then that bubble should start filling back in the syringe.
That we're referring to is going to be the stove installation.
So once it's finished, and I can go ahead and remove this catheter. And I discard. So next, after I remove the catheter, I provide peritoneal care. So I one out here, one right here, one right down the middle with warm soap and water. Discard of my gloves. And I'd go ahead and raise the side rails, lower the bed back down to the ground. Position my patient comfortably, and I make sure I place a call light near. Now with documenting, I document the color of the urine, how much urine, my patient's response, and I'd make sure I want to teach my patient about urinary tract infections and tell them some symptoms. So some symptoms of urinary tract infection is pain while urinating, blood while urinating, pain and discomfort in the abdomen, and then a frequent urgency to urinate. And so I always want to come back and make sure and check my patient 4 to 6 hours later and see if they voided. If not, I would palpate on the abdomen or feel on the abdomen and see how it feels. And that completes my check off.